Hi, my name's Anna. I'm going to be your nurse today.
Hi.
Can you give me your name and your date of birth?
My name's Kaylee Quinn. Date of birth is January 23rd, 2003.
Awesome. Today I'm going to be performing a head-to-toe assessment on you. It's going to be 15 minutes or less. Is that okay?
Yeah, no problem.
Alright, before we begin, can you tell me if you have any allergies or reactions to food, medications, or the environment that I should be worried about?
No, nothing.
And then, are you in any pain today? And can you rank it from 0 to 10, 0 being no pain, 10 being extreme pain?
I'd say 0, no pain.
Okay, then let's begin. Doing a general survey, patient's facial expression is calm and content. Her affect seems bright and happy. Patient is well groomed. She's clean. Her posture is relaxed. She's showing no signs of discomfort or acute distress. There are no obvious signs of deformities or places of concern. And overall, she is relaxed and in no discomfort. Alright, moving on to the skin and nails assessment. Her skin at glance looks dry and intact. Feeling her upper and lower extremities, they are worn, adequately perfused, and an appropriate color for race. Can I see your hand, please?
Yes.
Looking at her nails, they are round, showing no signs of texture, deformities, or clubbing. They are at an 160-degree angle. They're adequately perfused, pink, and an appropriate color for race. I'm going to pinch her skin. Pinching the back of her hand for assessing turgor. Turgor is adequate. Skin is hydrated, and there is no signs of tenting upon pinching. Alright, now we're going to move on to neurological assessment. So far, patient has stated her name and date of birth and the amount of pain that she's in, which is 0. So that is alert and oriented times 2. Alright, Kaylee, can you tell me the day of the week?
It's Thursday.
And then where are you right now?
I'm at a doctor's office.
So that is alert and oriented times 4. Her level of consciousness is alert and awake, and she is responsive. Assessing her speech thus far, patient is not slurring speech. She is responding to directions accordingly and does not seem to be showing any signs of confusion. Now looking at her face is symmetrical. Her eyes are in line with her ears. There are no signs of drooping on either side. Features are symmetrical. Alright, can you give me a smile? Make an angry face, sad face, and puff out your cheeks. Upon facial movements, features of the face are symmetrical. They are responding without drooping, showing an intact cranial nerve 7, and facial muscles are responding adequately. Alright, now I'm going to look at your eyes. Looking at her pupils, they are circular, round, and equal in diameter. I'm going to shine a light in your eyes, and we just want you to stare at my forehead, please. Pupils are showing a consensual response in regards to light stimuli. They are constricting when light is present and dilating when light is not present. I'm going to have you follow the tip of my pen. Patient's ocular motor muscles and movements are moving normally and adequately. She's able to follow the tip of my pen without any struggle. Alright, now I'm going to have you follow this tip as I move it in and out. Patient's pupils are showing adequate signs of accommodation. They are constricting as I move my pen closer and dilating as I move the pen further away. And now, do you have any hearing loss today?
No.
Alright, regardless, I'm still going to perform a whisper test on you to assess your hearing.
Sure.
So I'm going to have you cover your right ear, and then I'm going to whisper 3 words into your ear, and then I want you to repeat them for me.
Okay. 1, 2, 3.
And I'll cover your left ear.
A, B, C.
Hearing is adequate. There are no signs of loss. Alright, moving on to the nose, mouth, and throat assessment. Looking at the nose, there are no signs of drainage or discharge. Kaylee, have you noticed any discharge coming from your nose?
No.
Alright, can you cover one nostril and then sniff? And then the other. So nostrils are unobstructed and patent, and there is no signs of discharge. Looking at her lips, they are pink and adequately perfused, showing appropriate color for race. There are no signs of obvious lesions or any deformities. Can you smile? Looking at the patient's teeth, they are intact and showing no impairment of any kind. Looking at the patient's gums, the patient has pink, adequately perfused, moist, and healthy looking gums. Can you open your mouth and stick out your tongue? Looking at her tongue and mouth, the soft palate and the tongue are symmetrical. It is moist and adequately perfused. It is pink, which is the appropriate color for race. And then I'm going to have you tilt your chin up. Looking at her trachea, can I touch her neck?
Yeah, no problem.
Touching her neck, her trachea is midline and showing no signs of deviation, which is good. Alright, now moving on to the respiratory assessment. Upon glance, patient is not in any respiratory distress. Her breathing is unlabored, and she's not using her accessory muscles to assist with breathing. So her breathing looks comfortable. Alright. I'm going to listen to your breath sounds. So I'm going to have you scoot forward, and I'm going to listen to your breath with my stethoscope. For the purpose of this video, I will have the patient leave her clothes on. In a clinical setting, the patient would either remove her gown, or I would palpate and auscultate under the gown. Alright. Every time I move my stethoscope, I want to take a deep breath in and out.
Got it.
And then I'll have you move this way a little bit. And then same thing. Every time I move my stethoscope, take a deep breath in and out. Okay. Then I'll have you lift up this arm. And then the other arm. Alright. Breathing sounds are clear and equal bilaterally on the anterior, posterior, and lateral sides of the chest. There seems to be no problems breathing there. Alright. Now I'm going to move on to the cardiovascular assessment. I'm going to be listening to your heart. Again, for the purposes of the video, I'm going to listen over the close. Again, please sit forward. Yep. Aortic valve. Pulmonic valve. Herb's point. Tricuspid valve, and mitral valve. Alright, I'll be palpating or auscultating the apical pulse for 1 minute. Alright, So your heart rate was 74 beats per minute. I heard a normal beating of left up. There was no extra sounds or murmurs, which is good. Alright, can I see your hand, please?
Sure.
Now I'm going to be assessing capillary refill. Upon pinching her nail bed, capillary refill is less than 3 seconds, which is good. I'm going to see both your wrists. Turn them over. Thank you. Listening for your radial pulses. Radial pulses are equal bilaterally and at a strength of 2+. And then would you be able to remove your socks, please?
Sure.
Now I'm going to palpate the dorsal pedis pulse. Dorsalis pedis pulse is equal bilaterally at a strength of 2+. I'm going to assess the capillary refill on your toes. Capillary refill on toes is normal. It is less than 3 seconds. Okay, you can put your socks back on if you like. Alright, awesome. Now I'm going to be performing the gastrointestinal assessment. So, Kaylee, when was your last bowel movement?
This morning.
And when was your last void or urination?
An hour ago.
Awesome. And then were those normal? Did you have any pain with those?
No pain. All normal.
Okay. And then do you have any pain in your abdomen that I should be aware of?
No.
Okay, okay. Awesome. I'm going to have you lay down. Thank you. For the purposes of the video, I'm going to leave the patient's clothes on, but normally I would remove her top to be able to see the abdomen. The abdomen's contour is flat. There are no signs of distension or obvious herniations or bulges from any angle. Alright. Then I'm going to also tape in 4 quadrants of her abdomen. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. You can sit up. Bowel sounds are normal active. I did not hear any abnormalities, which is good. And then finally, I'm going to do the musculoskeletal assessment. So, you'd say seated for this part. I'm going to have you push with the tops of your feet against my hands. Awesome. And then the bottoms of your feet. Good. Strength of the lower extremities is equal bilaterally. There was no faltering, and the strength is 5 against resistance. I'm going to have you squeeze my hands, and then push against my hands. Strength of upper extremities is equal bilaterally, and strength is 5 against resistance. Alright, now I'm going to have you stand up. I'll have you come over here. Alright, I want you to take 5 steps this way. Patient's gait looks steady. Her balance is good. She is moving without assistance, and her gait is symmetrical, showing no signs of concern. And then I'll have you take 5 steps this way, heel to toe, please. Again, gait and balance are steady. They are symmetrical, and it's normal. No assistance needed. Yeah, good. Alright, you can take a seat back down. Alright. If we were in a room with a bed, I would make sure the patient is comfortable. I would lower and lock the bed. I would make sure 2 side rails are up. I would hand the patient their call light. And then I would ask, is there anything else I can get for you?
No, you were great today, Anna.
Awesome. And you just let me know. Give that call light that button a push. And yeah. Thank you so much, Kaylee.
Thank you, Anna.